Hi, I'm Caitlin over here at TherapyWorks, and today I am joined by our very own Britani Baxter, one of our awesome PTAs, who is stepping in today to talk about jaw pain and TMJ. So just to kind of like kick it off, Britani, can you tell us what TMJ dysfunction is?
Yeah, so TMJ is the shortened term, but what it stands for is it's the temporomandibular joint. So it's right where kind of the temple and the jaw meet. So it's that joint that's responsible for opening and closing the jaw. The TMJ dysfunction itself is going to be any problem that you have with this joint. It could be pain in the joint, whether it be with chewing food, or it could be, pain just trying to open the jaw or open the mouth. Any stiffness, sometimes TMJ patients will experience, they can only open a certain distance, but they can't open their mouth as wide as they would like to be able to eat certain foods. And then also any clicking or popping that you may experience within the joint.
Okay, great, thanks. This is kind of one of those topics that, like, unless you have had pain with this particular part of your body, you might not know a lot about it, because it's just like not as common to talk about necessarily.
Right.
So what are some like common causes of TMJ dysfunction?
Yeah, so sometimes it can come from injuries. So we'll sometimes see it in athletes, especially your soccer players, your football players, whether it be heading the ball could cause it, harder hits with tackling, but then even baseball, softball, anything like that you could, boxing, anything where there could potentially be some kind of impact to the jaw. But then it could be something that's not even sports related. It could be if you clench your teeth, whether it be consciously or subconscious in your sleep type thing, or grinding of the teeth is another one. And then because it is a joint, it's going to be subject to arthritis, just like our knees and hips would be as well.
Right, of course. So if someone's experiencing some TMJ dysfunction, what are maybe some like I don't know, are there stretches? I don't know a lot about this. So are there stretches that can help out?
Yeah, so some of them will have you do, or even just basic neck stretches, anything to loosen up the musculature around the jaw so that the muscles that support the jaw aren't having to work as hard. So even your basic, just like ear to shoulder stretch, you can do one where you're kind of looking up and over the shoulder. That's going to get a muscle that runs kind of from that same area down towards the sternum and clavicle. But then we could also do jaw stretching as well. So having a patient open their jaw as far as they can comfortably, because obviously we don't want to make the pain worse, and then just holding that for 5 to 10 seconds. And then even lateral movement. So whether it's moving the jaw to one side or the other, and same thing, staying within a comfortable range and then kind of holding that for 5-10 seconds, doing it a handful of times.
Okay, interesting. And you kind of mentioned the neck. Do you have any more details about why that helps? I don't know. It just I find that really interesting. That
yeah, so a lot of it
help for jaw.
Right, and so we see it a lot of places within the body. If even we'll take shoulders for instance, if you're tight throughout the chest, it's going to pull you forward here, which is going to put strain on the back of the neck. So very similar here. If you're tight in the back of the neck, or even the muscles in the front of the neck, it's going to tighten everything else above it. A common kind of analogy that you'll hear us talk about here in the clinic is if you were to pull even the bottom of your shirt down, you're going to see the top of the shirt move, and it's going to restrict movement everywhere else. Very similar to the muscles and the fascia around the muscles. If you're tight one place, it's going to pull and affect other places around it.
Okay, great, thanks. So we kind of talked about stretches, and maybe a little bit about movements. Are there other movements or exercises that TMJ patients usually do?
Yeah, so a lot of it that we're going to do with them is a lot of just trying to get that jaw going. We're going to really have them opening and closing the jaw quite a bit. Like I said, we're going to do that side to side movement of that lower jaw. And we're going to watch for symmetry between it. So if we see, kind of, they can move the jaw, lower jaw to the right really far, but they can't move it very far to the left, and all the pain's on that left side, then we know we've got some restriction there that we can kind of use some of that manual therapy and work some of those muscles around the jaw. There's it's not a big muscle, so we're not going to spend, it's not like your bicep or something that we're just going to crank out a bunch of strengthening exercises, but any of that moving it side to side is going to help to strengthen it, and like I said, and holding those stretches to get it loosened up.
Yeah, that's a good point. And like what you said, like about the bicep, I think that a lot of times when we think about strengthening, we think about like building like big bulky muscles, when really it's just like making sure that your muscles have the ability to perform the tasks that they need to perform throughout the day.
For sure.
So, we kind of talked about what to do if you like have some jaw pain or TMJ dysfunction. What are some good ways to avoid it though?
Yeah, so some of that stretching we talked about is always going to be a good place to start. Anything to kind of loosen it back up. We want to get movement through the joint without it being painful. So even if that's very small movements, that's going to be better than either doing nothing or pushing it way too hard. A lot of it also is going to be just kind of paying attention to your jaw throughout the day. Are you noticing that you're clenching? Are you noticing that you're grinding the teeth? Are you, somebody who is constantly chewing on like harder objects, ice, different things like hard candy is going to affect it as well, especially if you're chewing, especially if you're constantly chewing on one side, that's going to just put that side of the jaw off just slightly from the other side. And so paying attention to stuff like that and being able to just consciously relax those muscles, even if it's, I tell patients a lot, especially with neck pain, set a 20-30 minute timer on your phone, set it aside. When it goes off, kind of assess where you're at. Is the jaw clenched? Are you grinding your teeth? That type of thing. I think is a great place to start. It just kind of brings awareness throughout the day until it does become more subconscious to be more relaxed.
Great, thanks. Yeah, like I said, like I definitely do the ice, and I had not thought about that. I probably should just drink water. Oops. Oh well. So a lot of times we talk about kind of when to seek treatment. Could you talk a little bit about like why it's important to seek treatment early?
Yeah. So one of the biggest things is the earlier we get started, the more options we have. We can kind of tackle it from several different directions when the pain isn't quite as severe. But if you're waiting until either the pain is, constantly 7, 8, 9, 10 out of 10 pain every single day, there's only so much we can do without risking you feeling like you're just miserable and it's not helping because the pain's so high. The other side of that is the longer you wait, especially if you're somebody who the jaw feels like it's locked. One, that's not any fun because you're having to restrict what you're eating to compensate because of not being able to open the mouth as far. But it also, we're going to have a lot more of the adhesions and tight muscles to work through before we really start seeing some good progress, just because of having to wait so long.
Right. Not to say that we can't help you. It just, it's a longer road when you wait longer, and it's exponentially longer when it gets to that point.
For sure. And that's, that is one thing I like to remind patients when they come in, most of these things don't happen overnight. So our solutions aren't going to be overnight, but the longer you wait to come in, the longer that fix is going to take. Right.
Absolutely. So, kind of talking, like you were saying, like seeking treatment early, but like a lot of TMJ dysfunction comes on like very gradually. I mean, you mentioned injuries, but a lot of the other stuff like grinding or clenching, like that's a very gradual thing to progress to, really needing physical therapy. So, if someone's watching this video and they're, thinking like, well, I'm maybe on the borderline, like, how do they know when it's bad enough to really come and talk to us?
Yeah, so a lot of it again is going to be, especially if you've got that loss of motion. If it's becoming gradually harder for you to eat what you want because you can't open your jaw far enough to eat the cheeseburger, or different things like that, that's when things are getting to the point where come into PT, we can help. But even if you notice when you go to yawn at night or first thing in the morning and your jaw hurts, or you feel like it pops, or maybe you feel like one side moves just a little bit smoother than the other, that would be another time when it's good to go ahead and give us a call. I mean, if nothing else, we come in, we can assess it, tell you what we think. If it's something that we don't think is to the point of necessarily needing PT, we can talk about other routes. We can give you a few stretches and everything, and just be a kind of a, hey, kind of start with this, keep monitoring it, give us a call if it worsens. But realistically, 9 times out of 10, there's going to be something that we can help with.
Right. And honestly, if you're asking that question, it's probably time to talk to somebody. Like, I think that sometimes people think like, oh, well, everyone wonders from time to time. No, everyone does not wonder from time to time if they should talk to someone about their jaw. Like, that's not a thought that most people have. So if you're thinking about it, it's probably time to go and talk to somebody.
Right.
And I'm glad you did mention those those initial, talks with therapists, because those are complimentary consultations that we do offer, and they are phenomenal. I love them because, it's just a very quick, just like 10 to 15 minutes. You sit down with someone on our physical therapy staff and you talk about, what you're experiencing, what you've tried, what you maybe haven't tried, and kind of just talk us through like what you've been going through. And then we're able to point you in the right direction. So like Brittany said, sometimes it is just, here are a few things to send you on your way, or, it's not quite to the point yet where like we would need help, and sometimes it's, hey, actually you need to go and talk to this other medical professional, or sometimes we'll send you back to your primary care provider. But if it is physical therapy that you need, we can get you in usually within about 2 days. We can get you on the schedule, and we can help you to sort out any paperwork that you would need for insurance as well. So, either way, whether it's, we're sending you to other resources or we're, moving forward with you here, either way, that you're moving towards getting it handled. And so it's just such an easy thing to do. And we can usually, since the appointments really are only 10 to 15 minutes, we can usually offer them within about 24 hours. So, which is so great. You don't have to wait like weeks or months to get an answer. You know what your actual next step is to go and handle it. So if you're wondering, and like I said, they're completely free. It's no obligation. It's just so easy. So if you're wondering if like your pain is bad enough, or if, where to go for help, or, what your next step should be, go ahead and start with one of those complimentary consultations. You can give us a call at 785-749-1300, and we'll help you get started. So lots of great advice today, Brittany. Do you have anything else you'd like to add before we sign off?
No, I think that was a good point that you had about the, we can potentially refer you to or recommend you following up with a different provider. A lot of it with TMJ, because it is dealing with the mouth, especially if you're somebody who is clenching your teeth at night or grinding your teeth at night, that may not be something necessarily we can 100% fix in PT. We can give you the tools to know how to relax the jaw and everything during the day, but it may be something worth talking to like a dentist or an oral surgeon about some kind of night guard type of thing for nighttime, to just really kind of solidify everything that we've done here.
Exactly. So there are like lots of different options. And, you know, I always like to say like TherapyWorks has been in Lawrence for 29 years now. Yeah, like 29 years. So like if there are resources, we know what they are, we know where they are. There's no need to, you know, spend tens of hours on the internet trying to figure out, you know, what kinds of things are offered by whom and what is possible here. Like we can help you out. We can point you in the right direction. We know how to get things done and taken care of quickly, so you're not, you know, wasting your time going down long long routes. Everyone knows, you know, medical journeys can kind of be like a little winding sometimes.
Yes,
So
for sure.
it can be great to have a resource like that complimentary consultation to kind of get you started on the right track. All right. Well, thank you so much for joining me today, Brittany. And thanks everyone who tuned in.
Thanks.